to Thank you for joining us today for our webinar. My name is Joe Simonetti. I am the Director of Mentorship and Education at the Firearm Injury Prevention Initiative at the University of Colorado Anschutz Medical Campus. And this is our monthly webinar series where we aim to host novel and important work happening in the sphere of injury prevention and specifically firearm injury prevention, purely work that is novel and highlights collaborations that can inform some of the practices that we have. I'm really thrilled to introduce today Dr. Dan Semenza. Dr. Semenza is an assistant professor in the Department of Sociology, Anthropology, and Criminal Justice at Rutgers, as well as a director of interpersonal violence with the New Jersey Gun Violence Research Center. He's jointly appointed as an assistant professor in the Department of Urban Global Health in the School of Public Health at Rutgers University. He's also a faculty researcher with the Regional Gun Violence Research Consortium at SUNY, and an external fellow with the Health Criminology Research Consortium at St. Louis University. He earned his PhD at the Department of Sociology at Emory University in 2018, specializing in criminology and the sociology of health and illness under the direction of Dr. Robert Agnew. He's published more than 60 journal articles and book chapters on the causes and consequences of community gun violence, as well as the connections between mental health, criminal justice exposure, and violent victimization. Dan, Dr. Semenza, welcome. Thank you for being here today. With that, I'm going to leave it to you, and I will monitor the chat box for any questions that pop up.
Awesome. Joe, thank you so much for that introduction, and thank you all for being here. I really do appreciate you taking the time out of your busy days during the middle of the week to join us to learn a little bit about what we're doing. I just want to thank the center overall for inviting me. I really appreciate it. And I want to so like Joe said, I'm at Rutgers University and I'm at the New Jersey Gun Violence Research Center. A lot of what I do here is focused on doing research in issues of interpersonal violence. And I'm jointly appointed both kind of crossing in social sciences and in public health. And I want to kind of start off by saying that what I'm going to be talking about today is at the very early stages. And that's why I'm so excited to be able to be here and talk to you all now, rather than all of the data being out there and available and all of our processes being all set up, in a certain way. What I'm going to be talking about is very much prospective. And why I think that that's important is because community violence intervention, CVI, is in a moment right now. In a very big way, there was a major conference just last week in St. Louis for people who have received grant dollars, us included, to start up these programs and support them in a really legitimate way from the federal government. At the same time, there have been people who have been doing this work for decades, and it's continued to be refined and developed over the course of that time, but predominantly in large cities, large urban areas. And so the work that we're doing, in addition to kind of being very new from just the programmatic implementation standpoint, it stands out a little bit because it is not designed to take place in a large urban setting. And so I'm really hopeful, in addition to being able to talk to you about what we're doing, that you will have feedback or thoughts or questions that can promote thinking about what the best practices are going to be for this and how we might tackle some of the challenges that I'm going to put forward today that we're already experiencing a little bit, but also that we certainly expect to see over the coming months as we get this stood up and start really getting into the meat of it. So please don't hesitate to ask questions, and I look forward to that conversation. Okay. So my agenda for today is briefly for those who may not be as aware of community violence intervention. I want to introduce the concept and talk a little bit about what it is, make sure that we're all on the same page in terms of some of the terms that we used. If I learned anything from the national conference about this stuff last week, there are a lot of acronyms. So I'll try to make sure that those acronyms are relatively clear to everybody if you aren't already familiar. And then I'll go a little bit into the background of the project, kind of how we got to where we are now, and then some of the challenges and the opportunities that have really been identified uh, for the kind of implementation that we're talking about, as well as our current progress, right? The initial 2 steps out of a 6-step process. I'll highlight where we're at on those, and then we can talk about looking forward, what we're anticipating, and then get into the discussion and the questions. Okay, so first off, just from a definitional standpoint, I want to talk a little bit about, before we get into implementation or programs or anything of that nature, what it is I mean by the term community violence. Because there really are, when we use this concept of gun violence, capital G, capital V, it's often discussed as this monolithic term. And really, there are many different types of gun violence, and community violence is one of those. So community violence, as I define it, and I think many others would agree, it happens outside of the homes in public spaces. And it involves a relatively small number of people, either as victims or perpetrators, but its effects ultimately have the impact on entire communities. And what I mean by that is that for individuals who are engaged in shooting one another, that is typically something less than 3 to 5% of an entire city's population, often even much less than that. Roughly 5% of blocks in a given city might account for almost 50% of the violence that's occurring throughout the course of that city. And the individuals who are involved in shootings outside of the home are typically part of a small number of groups. And when I say a small number of groups, kind of the initial impulse might be to think gangs, but oftentimes community violence is happening between individuals that are having kind of beefs or arguments or shows of disrespect, or long-standing grudges between small groups that really push the definition of gangs, right? Because gangs is kind of a more formal concept, and for most of the violence that happens between individuals in these groups, they're more like small fragmented groups who live on the same block, or they're sets or crews that might engage in drug dealing together, or they might sell guns illegally together. But there's not necessarily a formal, colors and gang symbols and affiliation and all the kind of stuff that we might historically think about as gangs. And so I want to make it really clear that although gangs are part of this conversation, and historically might have been an even larger part, now we're talking more about small groups, and that's why I use that term. So it happens outside of the home. There's this overlap of victims and perpetrators when it comes to shooting, but ultimately most people who are shot are not killed. So this has an impact on the loved ones of individuals and the community members, the people who live there and hear about and witness these shootings. And it results from these kind of smaller conflicts that happen on a day-to-day basis. And this disproportionately impacts typically Black Americans, but all communities of color that live in areas with high levels of concentrated disadvantage, high rates of poverty, unemployment, lack of education, things of this nature. And so typically, this is in urban environments, so small neighborhoods or census tracts within a place like Denver, within a place like Camden, or Newark, or some of the larger cities like Chicago and Philadelphia near where I live. So that is kind of the overall definition of what community violence is. And this obviously differs very much from something like domestic violence, which take place between partners, predominantly in the home. Suicides, of course, because this is an interpersonal type of violence, or mass shootings being kind of one event where lots of people are targeted, maybe indiscriminately in a public place. And so this is often very, very different than those other types of gun violence that people will refer to. So understanding, what community violence is and having that sense, then we can talk about what community violence intervention is, or CVI, and I'll probably refer to it as CVI from here on out. So CVI is designed on a few core tenets to disrupt community violence that is happening between these small groups that is often very cyclical and retaliatory. The first and most important component of any CVI worth its salt is the employment and reliance upon trusted, credible messengers. And trusted, credible messengers are individuals often who come from the communities that are being served, not always, but frequently, who have legitimacy within the eyes of the residents that that person is trying to assist with. So sometimes this means that it is men and women who have been formerly incarcerated, who have been involved in shootings, in gang life beforehand, or who, even if they haven't been, are still long-standing members of the community, who have a kind of institutional knowledge of what it's like on the streets and what the behaviors of individuals are on a day-to-day basis. Often they'll understand existing beefs, they'll understand who kind of the crews and the groups and the sets already established are, and they have their kind of ear to the ground, finger on the pulse of what is going on in that community. And again, when I say the word community, I don't mean a whole city. I often mean, a neighborhood, a handful of blocks, some smaller community than an entire city, because that's really where violence happens, kind of at the community block and neighborhood level. And so credible messengers are really key for CVI, because what they do is they go and they work with individuals to try and disrupt retaliatory cycles of violence, people shooting and then shooting back in order to get revenge and retaliate against them. It is often the jobs of these credible messengers or interrupters in stopping these cycles. And so behind them, behind the messengers, is kind of a real engagement component and partnership requirement. And so that means having a CVI provider, so to speak, that is tied into the community more broadly, that has that institutional knowledge of what goes on in the community and the neighborhood, that is associated with things like service providers, that knows how to provide suggestions for housing, for getting access to food, for job training, that can do some of these things, even if they don't do that within the organization. So there's that real tie into community engagement that already knows the residents and is well aware of what is going on. And CVI tends to be most successful when it focuses on the highest individuals that are at risk for shooting. So there are lots of programs that exist, and I'm sure that they exist in Denver as well, and other parts of Colorado. There are lots of programs that will focus on high-risk people, often high-risk youth, maybe kids who are 12, 10, 11, 12, 13, 14, who are not really at that age yet where they're, at greatest risk for shootings or being shot. But maybe they're starting to get on the wrong path. They're engaged in more minor forms of delinquency. That is a high-risk group, but not the highest. The highest risk group is the individuals who often have already been shot, or they have an extensive criminal record and a criminal background, who have been involved in shootings before, who might have serious substance use issues, who are flagged as being unhoused or dealing with issues of housing throughout the course of however many years. So there are all these different things that go into making an individual at greater risk. And that actually tends to be men who are a little bit older than you might expect. We think of these kind of shooting cycles often as like processes of young people, but really the average age, and I learned this just recently, is more like 26, 27 for individuals involved in shootings. And so we're talking about people often who have families, people who have had a number of years that they've maybe been involved in the adult criminal justice system. And so that really changes the outlook on targeting for intervention when we think of that rather than this kind of next group, which is high risk youth. So it's not to say that those programs aren't important and effective from kind of a prevention, more upstream approach, but that the highest risk is really going to be the ones that tomorrow we're concerned about shooting. Community violence intervention is often trauma informed, so there is some sense and understanding within the curriculum of the program that those that are doing the shooting have often been harmed before, and whether that's because they've literally been violently assaulted with a gun or otherwise, or the recognition that most people who are involved in violence have been traumatized somewhere prior in their life before, whether that is adverse child experiences, dealing with substance issues, parents, parental incarceration. There are all these different things that contribute to that trauma, but that approach is really key to being able to do proper outreach. This is a pretty core tenet. And then finally, there's this kind of fifth element, which is this emphasis on racial and social equity. What I take this to mean is CVI at its greatest success gets on the level of individuals, while also understanding that there are systemic structural issues that have led many communities to where they are with high rates of violence today. And so it means that when there are credible messengers on the streets doing interruption, when the programs are being developed to be trauma informed, that also comes with a background and an understanding that oftentimes these communities are places that don't have pre-existing access to good healthcare resources, that there is high rates of unemployment and poverty and all of these other things that have been developed by long histories of discrimination and segregation and just broader disinvestment. So I think the most successful program that is going to reach people has to also have this in the background. And so I mentioned this kind of term of cycle of violence, and that at the core of all of these programs, at the core of CVI, is breaking these cycles. And I emphasize the core because what I'm going to tell you about with the program that we're looking to stand up in more rural parts of South Jersey, the environment where we're going to be in some ways is very different than where it has historically been implemented. And over the past couple of months, the conversations that we've been having have basically followed along the lines of, yes, maybe we're talking about more rural areas, more spread out, different access to resources, police relationships might be different. We'll get into that. But the core dynamics of how shootings are happening, about how homicides, on the street are committed, are the same as if you were talking about a neighborhood in Chicago or Kensington in Philadelphia or all these other different larger cities that tend to grab headlines and have a lot of the resources dedicated right now to CVI. And that's really breaking the cycle of initial violence, somebody shooting at somebody or at another group, retaliation against that violence, and then oftentimes within that retaliation, bringing in new parties, right? So that if you shoot at me and I want to get back at you and retaliate, that I can't access you, right? You might be in a hospital, or you might, have kind of gone underground and I can no longer find the person who shot at me. Well, then I'm going to go shoot at your friends, your brothers, your cousins, your uncles, whatever it might be. And so that's a new way of bringing in new parties, reeling in a broader social network of individuals, which is still relatively small. But when those new parties are brought in, it fleshes out these cycles of violence even further. And again, this tends to perpetuate over the course of very long periods of time. And so just to kind of ground CVI in some examples, these are some that I was very inspired by even just last week in the conference that I'll tell you about in a second. I think one of the largest providers for community violence intervention is Cure Violence. Many of you may be aware of them. They had a documentary in 2011 called The Interrupters, which is excellent and kind of really shows you the nitty-gritty of what it's like on a day-to-day for a lot of the credible messengers. But Cure Violence has existed for quite some time now, and now there are other groups that have been really effective ROCA is in Boston, and they've been doing some great work in Massachusetts. Ready Chicago, out of the Heartland Alliance, they have done a lot of really great work in CVI. They've done some really good evaluated work, so they've been able to show the significance and the effectiveness of this kind of work. And then there are groups like Advanced Peace out of California that have also been doing this. And each one of these, and there are many, many, many more, each one of these has their own flavor to some extent. So even though I've kind of given you the core tenets of credible messengers and trauma-informed and targeting highest risk, that a lot of times there are other programs that are attached to these. So, there might be Big Brother, Big Sister programs or programs that specifically target individuals who are at high risk rather than highest risk, or people who are dealing with, substance use issues or have domestic violence backgrounds, right? So there can be different types of iterations depending on the needs of the community that they serve. But at the end of the day, all of these have in common this idea of credibility and legitimacy in the community, that the community heals itself from within rather than relying on the police to reduce violence. So this is just, again, for anybody who may not be as familiar with Cure Violence, these are the three kind of core tenets as Cure Violence would outline it. So the first step is really to detect and interrupt violent conflicts, so to prevent retaliation and mediate conflict. That then moves into trying to change behavior. So people use this term all the time, once you've hooked an individual and kind of gotten them out of that cycle, continuing to provide support, challenging the thinking on the use of violence from the get-go, and most importantly, in my mind, to diverting people off the path, figuring out what they need and getting them what they need, right? I need a place to sleep. I need food on my table for my kids. I need therapy, whatever that might be, connecting to job opportunities in particular and other types of social services. And then more broadly, when this starts to take hold in the community and more people that aren't involved in shootings become aware, that violent interruption spreads out and is designed to kind of shift community norms so that there is a greater community response when shootings do happen, continued organizing and spreading positive norms around or against the use of violence. So a lot of Cure Violence is tied into the public health model of disease prevention, and the norm shifting is very much a part of that. Okay, so I gave us a little bit of time to give you the baseline. Now I want to talk more about the project that we're doing with the remaining time that I have. So the project background is, like I said, we're living in a moment here right now where people have been doing community violence work for decades, honestly, longer than I've been around in some cases. And just recently, the government has really started to take a different approach to how it thinks about violence reduction, and that the police are not the only option, not the only opportunity, and in fact often can do more harm than good in violence reduction. We have had a major reduction in violence since the early 1990s overall as a country, but when you look at the very disadvantaged communities that happen to be in urban environments, but not always, that are, suffering from a lot of poverty and unemployment, violence has continued to be quite stubborn in those places. So, maybe overall as a country, things had gotten better, but not for everybody. And certainly in the last few years since the pandemic, when communities were unable to really mobilize for themselves, it's shown a light on this idea that community violence interruption and the programs that support it are really, really critical. So this year, the Department of Justice dedicated $100 million in funding. So it's about 50 new or existing expansions for CVI programs across the country. We all met last week in St. Louis. All the heads of the Department of Justice were there. Merrick Garland was there. And there is a commitment, right? There's clear support and backing for programs that are outside of traditional policing. They're dedicating another 100 million in the year to come. So the time is now to stand up these projects, to figure out what works best, to share best practices, and to implement it in places that maybe they haven't been implemented before. And that's why we're here. So our plan is taking the core tenets of CVI. We're looking to implement a CVI program in more rural underserved areas of South Jersey. And so for those of you who don't know, those of you who aren't living in Jersey or haven't, been a part of Jersey for a while, my wife was born in Jersey, but she was born in North Jersey. And I've been here for about 4 years now, and I've come to learn that there's a major divide in New Jersey between North and South. South is a more rural and relatively poorer area of the state, although compared to the rest of the country, still relatively high. So there is a difference, and that's why we're focusing more on South Jersey. And then the plan is to collaborate with community partners to set up the program for sustainability, and then ultimately expand this to jurisdictions in the rest of the state. So our team, the grant that was originally written was led by Ascenda Integrated Health. They are a community health company that is around New Jersey with an emphasis in South Jersey. They have offices and locations all over. They have the kind of pre-existing infrastructure within the community to make this scalable and to do this on kind of operational level, the day-to-day stuff. But part of the grant is to help or to get assistance, technical training and assistance in particular, from Cure Violence. We are partnering with Life Worth Living. This is a partner that is already embedded in some of the communities in which we're going to be in. And then myself and some postdoctoral and doctoral fellows at our New Jersey Gun Center will be involved in helping to stand this up, inform what research and literature says on this stuff, and then eventually be able to help with the evaluation approach to seeing how this all worked out. So like I mentioned, most CVI programs are in large, dense urban areas, and New Jersey is #1 in population density throughout the country. But despite the fact that there's a lot of people in New Jersey, that population density is not equally dispersed. And as I mentioned, it is far less dense in South Jersey than it is in North Jersey. So if you look here, kind of right above this red circle, that's Camden, right across the bridge from Philadelphia. This is near where I live. And then a little bit further south are much more spread out, more rural counties, which there are areas in these counties that have pockets of a lot of violence, but get a lot less resources. And so not to throw too many numbers at you, but just so you have a sense kind of relatively, here are the homicide, aggravated assault, and total crime or violent crime rates for the US and New Jersey up here. And then the counties that we're focusing on 2 counties, maybe a third, but right now, the goal is to be looking at 5 different places, and we're in the process of figuring out where to start. But I think it's really important to look at some of these numbers of population. There are places like Vineland that have a bit bigger populations, but Bridgeton and Millville, and then especially the 2 spots in Salem County that we're looking at, small populations, 5,000 people. So these are rural spaces, much more spread out. They have some urban infrastructure, but they're embedded in very rural counties with a lot fewer resources. And then you look at the homicide rates. Well, for Penns Grove and Salem City, those are being driven by like 1 or 2 homicides because the population is very small. So that's less important to looking at the aggravated assaults or total homicide rates or total violent crime rates, which are off the charts compared to New Jersey as a whole, and even the broader United States. And so we knew going into this that there were these pockets in South Jersey that are just underserved more generally because of their rural environment, because they're not part of the northern state that tends to get a lot more attention, but also because of these specifically high rates of violence in those areas. And I should say that in pretty much all 5 of these areas, especially in Salem County, we are talking about very, very high poverty rates, very high rates of unemployment, and these communities are predominantly African American in most of the places that we're talking about. So, and just so you know, all of these rates are per 100,000, just to help relativize everything. And I used 2019 rates pre-pandemic before things started really getting wonky and hard to track trends on. So we know that there are these particular violent hotspots. We wrote the grant to focus on some of them, and the goal is going to be to target them initially and then ramp up to try and address multiple spots with our partner. There are a number of challenges, though, for a rural program. And so I'm going to talk about the challenges and then the opportunities. The first for a rural program, and I'm learning about why this is different than somewhere like, Chicago or Philadelphia, is that oftentimes rural communities like the ones that we're talking about, it is harder initially to build trust. I mean, I think that it is hard for any group or organization to go in and say, hey, we want to come do X, Y, and Z service, or we know the answer to, reducing crime and solving violence, right? But in rural areas that are often not approached, that are not serviced, that don't have the resources, the individuals being used to accepting these kind of resources or offers is going to be even less. And so building trust with potential community partners outside of the ones we've already identified, but also just building trust with the residents, right? Just like if a credible messenger comes out and says, hey, I heard X, Y, and Z is going on and you're thinking about getting back at them shooting, what is that going to look like in a rural area that may not have any exposure to this kind of work compared to some place like Philadelphia, which has had cure violence implemented in many parts of the city before. So that's certainly an area that we are attuned to. The other is that the dynamics of local conflict can be different. And we're starting to learn this a little bit more as we talk to community members and service providers already there. Local conflicts, there are far fewer people. So the number of crews and groups and sets might be relatively few. There might be only a handful of individuals or groups that are involved. And the nature of those dynamics might be different. One thing that I have learned is that oftentimes in more rural areas, they are multi-generational. So they are disputes that have gone back and forth between dads and sons and uncles and cousins over the course of a long period of time, to where, I'm not trying to be glib, but if you were to ask people, I think in some sense, people would not always be able to remember the etiology of a conflict or the very beginning of why this retaliatory cycle might have begun. And that is a challenge because it's a bit less identifiable and maybe a bit different than we would expect, where there are lots of different crews or gangs that are involved, and you can kind of point to the reasons behind some of these conflicts that maybe not be as long-standing as some of what we're seeing here. The other is just a more practical one around distance and geography. People live much, much further away. People drive to each other's houses. So what is that going to mean for credible messengers who need to get around, who need to get at people quicker? That is a barrier, it is a potential protectant in that it might reduce the density of shootings, and it does, but it is a barrier in terms of rethinking a little bit how the day-to-day walkability of some of this stuff goes. And then finally, typically areas that we're talking about are going to be under-resourced, not just around rates of poverty and employment, education, but there just are not a lot of existing community partner programs to begin with. And so because of that, there's just less of a sense of norm around some of the infrastructure of community outreach groups than there are in most cities. And so the flip side of some of these challenges, though, is that there are real opportunities. And this is how we see opportunity for trying to develop a program that is based on the core tenets of community violence intervention, but is done in a way that is more responsive to the needs of individuals in more dispersed, smaller population areas. And so I'll talk about concentrated social networks, the police relations, and then again, partner sites for engagement. So when it comes to social networks, Andy Papachristos and Anthony Braga and some of these, amazing scholars have done the work to really show that it is a small number of high-risk individuals who are involved in shootings, even in the highest risk environments, even in neighborhoods that have a lot of violence already in them. So for a rural community like Salem City or Penns Grove, where there are 5,000 people or 10 or 15 or 20,000 people, that number is going to be even smaller. The number of crews and groups is going to be smaller, which makes them ideally more easily to be targeted and intervened with, right? That ultimately, when we really get into pre-assessment, starting to identify that social network of individuals who are involved, that should be a graspable number for credible messengers to go do outreach on and then follow up with. Whereas places like Chicago, where this work has been done the most, or places like Philadelphia, these are high population areas that might make it harder to track, or just would require a lot more resources in terms of hiring X number of credible messengers and support for those workers to do their jobs. So I think that the smallness of this can work to an advantage. People also might be more likely to know each other so that we can create these identities a little more readily, and that there's going to be this multi-generational sense within a more rural area that you wouldn't always see in an urban environment. It may not be as different as we expect, but I do expect that to come into play. And then, of course, in an area that is relatively smaller number of people, there's going to be maybe a collective greater sense of shared sense of place and local culture. So all of this potentially making that pre-assessment upfront work of identifying high-risk individuals more attainable, and then allowing for greater incidents of follow-up and resource allocation and service diversion that would help people be successful in kind of desisting from violence. The police relations is another area that I think we're just starting to get past the theoretical into what is practically going to look like in the communities that we're talking about. And so oftentimes in rural areas, officers have to be much more flexible. They work in multiple roles. They work on lots of different types of crime. There might be way fewer individuals who are a part of a police department. And as a result, they might be more amenable to working with a program and a solution like CVI. Oftentimes, the police and CVI programs will work in tandem with one another. Sometimes they'll collaborate, but CVI can't collaborate too closely with the police. Otherwise, it's a harm to legitimacy. So it's a delicate balance, no matter where you're talking about doing this. In rural counties, our hope and our expectation is that there might be some flexibility here for existing police relationships that would allow kind of a more informal exchange of resources where the police can help both upfront and then help as the program is getting worked on. Oftentimes, officers have closer ties to the community. They might be from the areas where they are doing their work. And that matters for the individuals that they are serving, which again might be multi-generational families. People may be much more likely to know the police, and as such could potentially have more of a willingness to cooperate, which we know is really important for solving cases and solving crime, but also helping to legitimize the use of CVI so that people will work with the credible messengers when they come into the community. Okay, and then the final part that I want to really highlight is community partner engagement. Now, like I said, in a lot of more rural areas, there are much fewer resources, right? Fewer existing agencies, social service providers, or providers that maybe work with high-risk individuals rather than highest risk. But the existing agencies that there are, and we're finding this to be the case, may be more flexible and can work in multiple capacities. So they do not have the giant caseload burden or the kind of bureaucratic necessities that some other much larger groups might have, and can add a CVI component into their work, even if they haven't historically done that. Employees might be much more familiar with the places and the people in the region, right? If you're working in an area that is 5,000 individuals or 10,000, you may know a lot more of your constituents and the people that you're working with than if you're working within one neighborhood in the part of Chicago that is, much, much larger. And one thing I think that we're also seeing and hoping to see a lot more of is a willingness to engage in partners. Places, large cities might, the community partners there might constantly be getting asked by universities and researchers like myself and potential partner collaborators, hey, do you want to collaborate on this? Do you want to do this? Do you want to pool resources on this? So there's this kind of, exhaustion, I think, that can come from that in urban settings where that might not be as much of a barrier and therefore help alongside some of this flexibility for potential partners in more rural areas. Okay, so for the last couple of minutes, I just want to highlight what we're doing so far, right? And again, I mentioned that so much of what I wanted to present today was setting the stage, helping to talk about how we're thinking about things, and then looking towards the first implementation steps. So these are the 6 main steps as developed and kind of highlighted by the Department of Justice, who have worked with a lot of great people to really figure it out. And right now, the last couple of months since we got the grant to start thinking about all of this, we have been more involved in the first 2, engaging the community, doing an assessment of what we're going to be working on, and then forming the appropriate community collaborations. So right now we're meeting with stakeholder groups. We're meeting police departments, service providers, social services, the public health agencies that are going to help us get the necessary data that we need in order to figure out where violence clusters, whether that's street blocks or particular locations. So we're really meeting with those stakeholder groups now, as well as with Cure Violence to help set up technical training. And we're also doing the work to kind of learn the history of the towns and the counties that we're going in. Now, Ascenda has a lot of good institutional knowledge about this because they're already embedded in many of these places. But continuing to do this engagement and figuring out what exactly is needed and how we're going to tailor this program to these individual places, knowing that institutional history is going to be really important, both of the partners that are already there and then the towns broadly themselves. Assessing local violence is kind of the core area that I am a part of, and this means pulling together lots of disparate data sources, where the shootings happening, who are involved in them, but also who's being victimized, are most of them non-fatal versus fatal, what kind of communities are already in place, what their work has been done beforehand, is anybody already doing outreach, and then the historical landscape of what has been done in the past. And then forming the community collaboration. This is kind of what we're concretizing now, I think, in a lot of ways. So this is Life Worth Living. They are our initial community partner, and we're working with them to understand, okay, what is the current capacity that they have? What do they see as kind of additional resources that need to be supported by the grant to allow them to do their job in 1, 2, or however many places that we're going to be ultimately executing in. And if we need to identify any additional partners, whether those are service providers or any other kind of diversionary collaborators that can help in addition to the kind of core tenets of CVI and credible messaging. So our next step is kind of continue those first 2. We're going to initially, I think, drill down to 1 or 2 locations and figure out how we're going to ultimately scale up to some of these multiple locations in the region to do in-depth data collection on some of the key areas that I just mentioned. And then that will move into a real assessment with Cure Violence, who has done this all over the world. to figuring out what the technical training and hiring is going to need to look like for credible messengers in the area, and then moving into hiring those credible messengers sometime over the next few months so we could start the training and start doing the implementation. So with that, I think we have about 15 more minutes or so. And if I sped through anything, let me know. But yeah, I'm really looking forward to your questions and discussing whatever you'd like to learn from this. Thank you.
Awesome. Dan, thanks so much for that talk. Folks, if you want to add anything to the Q&A box, I can read them out for you. That was a really cool presentation about the early stages about how you're thinking about developing this work. I hope we can have you back once it's off the ground, and so we can get a little bit more about, frankly, lessons learned and outcomes and things like that. I had a couple of questions. You mentioned sort of early on, like the importance of the work being trauma informed, and I'm like wondering if you can like elaborate a little bit about that. I do most of my work in suicide prevention, and like trauma-informed care is like part and parcel of what we do, and it has to be ingrained in everything that we do. I hear that language, I think, less when I hear about people talking about community violence intervention. So I just wondered if you could talk more.
Sure, yeah. And there are probably other people that can speak to kind of the more clinical aspects of this better than I could. But I think this idea of trauma-informed care is recognizing that everybody involved in community violence intervention has been touched by traumatic experience at some point. And so that is the individuals, obviously, who are doing the shooting or who are victims. It is the credible messengers who almost invariably have been shot at or shot themselves, or have lost family members or friends, or have been incarcerated, right? And it's also recognized. So, there's this very kind of individual experience of trauma that the people involved in the program are undergoing. And we know this because there has been work, even very recently, to look at the kind of trauma that is undergone by these community violence workers. And it's extensive, on the job, getting shot at, all of these other things that are happening on the day-to-day work. But it's also kind of stepping back even further and understanding that where these programs are implemented, the people who are even on the outskirts of the individuals who are engaged in shooting are at much greater risk for having undergone traumatic experiences in the past, right? So whether that's living in kind of a day-to-day type of very deep poverty, where a lot of these programs get developed, or it's experiences of parental loss, incarceration, violence, and abuse earlier on in life, that this tends to touch pretty much everybody that is involved with the program. And so that is how I think about it. Taking this to kind of its furthest extension means that well-resourced CVI programs have like licensed clinicians and psychologists that are able to work with the people who are doing the credible messaging that are out there on a day-to-day, and are also tied and associated with clinicians and therapists and diverting people to the kinds of therapy that they need. But in the broader sense, in just thinking about how we inform the programs and what goes into it, it's this recognition of trauma and touch points across everybody that is involved. Did that answer that, Joe?
Yeah, that really did. In healthcare systems, we think about sort of suicide prevention and peer intervention, which I think is sort of a nice parallel to what you're talking about in community violence intervention. And there's this growing recognition that it's hard work. And most of the people who are selecting to do peers and do peer intervention also come with a lot of traumatic lived experience. And so how best do we support people in engaging in this work, knowing that engaging in this work is very, very hard? Actually, we're trying to think about this, but I hadn't thought about other sectors of violence prevention who've probably been doing this work. So it's why I kind of asked you to elaborate on it. So thank you.
Yeah, and I would just say, like, in response to that, my answer, and I think a lot of people would say that the only way that you properly support these programs and the people who are doing the work is embedding them in like permanent social and institutional structure. So developing offices of violence intervention so that there are now state benefits attached to the job that goes into being a credible messenger, so that you are paid in a way that is equitable to, other employees within these institutions.
Yeah.
We've been doing, and I say we, but I mean the kind of the community of people doing CVI has been doing it so long on shoestring budgets that have ignored kind of the employment needs and kind of the database stuff that we all take for granted for the workers. And it's all more reason to make this stuff more formal and more institutionalized to protect the workers doing it.
That's a fantastic point. And oftentimes when we do this through research budgets, through healthcare systems, oftentimes peers can get reimbursed as almost research participants, which is not the same thing as somebody who's moved to the position. I have a question from Jonathan McMillan. What does emphasis on racial and social equity look like in these rural communities?
Yeah, it's a great question. So from my standpoint, taking the social equity first is understanding that many rural communities are just going to be under-resourced, right? And so that the people who are being served, the people who are involved in the shooting, are going to be also suffering in the background from a lot of kind of inequities when it comes to jobs, when it comes to access to employment, and living in poverty and access to education, right? And so that any program of CVI worth its salt needs to be able to provide access and recommendations in order to get some of these resources, whether that's job training or whether that's educational programs or housing assistance, whatever that might look like, right? So it's not just about interrupting the retaliatory conflict. Obviously, that's a key part in like stopping shootings today, but it's addressing these inequities, addressing the fact that as soon as you stop the conversation of interruption, the person is going back to their home, back into that same community, and going to struggle with the same kind of deprivations, that they were before you had that conversation. So that's what I think about kind of more social inequity. When it comes to racial inequity, traditionally, CVI has been embedded in communities that are historically much more likely to be African American, and the populations that it serves are going to be predominantly Black. I expect even in the more rural communities in South Jersey that the preponderance of individuals are going to be African American. And so all of the stuff around social inequity then has an additional component of racial inequity, in that people are often living in these communities because historically they were segregated and there was discrimination that has led to concentrated disadvantage in these locales. There's a real racial component to that. And so oftentimes that sometimes means making sure that credible messengers are going to be culturally congruent with the individuals that they are serving, but that the program as a whole is able to kind of think about these things more holistically and more broadly than just the interruption piece of it.
We have a comment. Wonderful presentation. Thank you. I work for San Diego Promise, and this morning we were discussing potential partnerships with violence interrupters for youth-based violence prevention. Several schools in DC and Minneapolis are embracing this avenue. So I look forward to your work and thank you again. And then Tracy went on to provide additional context. We're trying to figure out how best to collaborate with community rather than having a singular focus on the individual student. Tracy, thanks for that comment. And then I had one more question. So you talked about your data collection strategy and some of the outcomes that you're looking at in terms of injury-related data, public health data, police-related data. I'm wondering, are you thinking about sort of more proximal impacts that you might have in terms of how you engage the community, or you're helping the community build networks or social network analysis or anything like that? Like, is there anything you can study proximately about the impact you're having on sort of more the fundamental aspects of the community that then go on to prevent violence?
Yeah, I think that that's a great question, Joe, and it's an important one that's been kind of not looked at enough. And part of that is because there's real challenges to doing this kind of data collection. Jeff Butts and his group at John Jay College have been a group that have done this really well, because you can look at like pre and post, you can do all the kind of difference and synthetic control analysis to understand, hey, have number of shootings gone down, right? Or have hospitalizations for gunshot wounds gone down, related to the implementation of a program. Even if the answer is yes, and it's not always guaranteed to be, even if the program has been properly executed, the mechanism for why that is, we just go on and assume, okay, it's because there's been lots of great interventions and lots of credible messengers have come in and totally diffused retaliations, and that's why it stopped. But we don't know enough about whether or not that's actually the case. And so that requires surveying the people who are getting interrupted, right, who are kind of going through services. It also requires understanding kind of broader community perceptions, going and talking to people and saying like, do you feel safer? Do you know what these CVI programs do? These guys who are on the streets doing this kind of work, do you have any idea what that looks like? So I think there's that kind of broader way of thinking about it that really, really matters. We're trying to figure out what the infrastructure would look like to be able to do some of that surveying. So even if it's not more of like a formalized social networking analysis, just trying to get a sense of if we can show that the program is working, can we also show why it's working? I think that is really important, because, and even if we or anybody else who evaluates these can't show that the program worked to meaningfully, statistically significantly reduce shootings or homicides or whatever the outcome of interest is, if you can understand those mechanisms, then you might be able to show why it's not working or why the evacuation didn't go as expected to continue to build this out and follow best practices. So it's definitely on our mind. Just wrangling police department data from a number of different agencies and then hospitalization and things like that is enough to keep us busy from a pre-assessment level. And I think once we have that and have targeted areas of intervention, then we'll be able to kind of do that next level mechanistic approach.
Okay. All right, so we're approaching the top of the hour, and so I think that about wraps it up for today. Dr. Semenza, I just want to thank you again for being here to present on this important work. It was a great talk, and we'll look forward to having you back. Thank you.
Thank you all so much. Take care.
And look